LASIK is a procedure in which we reshape the cornea to correct your refractive error and decrease or eliminate your need for glasses. For example, if you're nearsighted, the laser is going to flatten the cornea. If you're farsighted, the laser will steepen the cornea. It removes corneal tissue in a very precise, controlled way under the guidance of a computer as designed by the software and the surgeon. We normally remove a tiny amount of corneal tissue, normally less than 10%, to improve the curvature and the optics of your eye. When you have a refractive error, that means that you need glasses to correct nearsightedness or myopia, farsightedness or hyperopia, or astigmatism. And generally people have refractive errors because the eye is either too long or too short, or the cornea is too steep or too flat. There have been just amazing advances in ophthalmology in the last few decades that now allow us to correct refractive errors in a number of ways in order to eliminate them and decrease your need for glasses. Some centers advertise bladeless LASIK, which may not actually be LASIK at all, but rather PRK, where the treatment is delivered to the surface of the cornea. Initially, a solution is applied to dissolve the surface layer, and then it is removed with a brush or scraped, and then the laser correction is applied to the surface of the cornea. This is followed by a fair degree of discomfort and a more prolonged healing period. In contrast to that treatment, blade-free all-laser LASIK is a true LASIK procedure in which the LASIK flap is made with a very precise computer-controlled femtosecond laser, or intralace, rather than using a blade to cut the flap. The flap is then lifted and the vision correction applied to the inner layers of the cornea. At the conclusion of the procedure, the flap is replaced and healing is really quite quick and relatively comfortable. Some patients will have a mild scratchy feeling the first day, but when we see people back the next morning, people are comfortable and almost all of them are reading the 20/20 line already. Blade-free all-laser LASIK using the intralace laser combined with custom wavefront correction has been proven to provide better results and is really becoming the gold standard in refractive surgery. Just as glasses or contacts can help you see clearly, LASIK also can. In order to be a good candidate for LASIK, you need to be at least 18 years of age and have a healthy cornea. There are certain medical or ocular conditions that may make you an unsuitable candidate for LASIK. In our complimentary LASIK consultation, our professionals here at Bellevue LASIK and Cornea can give you an idea if you are a good candidate for LASIK. LASIK is possibly the most exciting development in ophthalmology in the last couple decades. LASIK is an excellent alternative to glasses or contact lenses for correcting your vision, and it has the potential to dramatically decrease your dependence on glasses or contacts and very likely eliminate them from your life. With most patients achieving 20/20 or better vision, that goal is definitely a reality with LASIK. Over 14 million LASIK procedures have been performed worldwide over the last decade, and in the United States there have been over 2 million in the last year alone. Many studies have shown that almost all patients achieve significant improvement in their vision. And recent studies have shown that having LASIK performed is even safer than wearing contact lenses. Technology in laser vision correction is definitely important. and is one of the key factors in determining your outcomes after surgery. We've made a significant investment in the very best technology available. We have the intralace femtosecond lasers so that we can offer very precise, safe LASIK flaps rather than being dependent on a blade to make the flap. We also have two of the industry-leading excimer lasers, the Vuzix Star 4 iris registration laser and the Allegretto wavelight laser. Having these different lasers allows us to choose the approach that would be very best for your particular eyes. In addition to the laser technology, we also have the very best diagnostic technology available. That allows us to do a very thorough, comprehensive evaluation of your eyes to determine your suitability for LASIK. We will thus be able to determine if you're a good candidate and if LASIK is appropriate for you. Procedure times are scheduled according to the patient's availability. On the day of surgery, you'll be here about 90 minutes, and that includes time for instruction in the postoperative care of your eyes. The actual surgery time is quite brief. It takes about 5 to 7 minutes per eye. As far as follow-up visits, we'll re-examine your eyes on day 1 and 1 month and 3 months. When people come back the next day, everyone has driving level vision, and the majority are already seeing 20/20 or better. That's going to allow you to be able to resume normal activities the next day, and most people feel like they could return to work right away. On the day of your procedure, you should go home and rest your eyes as much as possible. The following day, you can resume normal activities, including exercise, as long as you don't bump or rub your eyes. We do ask that you don't swim for a couple of weeks, but all other activities are approved. We anticipate that your final vision will be similar to or better than your vision with glasses or contacts. Initially, of course, there's a little fluctuation, a little bit of blurriness, but you'll be pleasantly surprised how quickly the vision improves. For a small group of people, we will do an enhancement if you're not satisfied with your vision or if there's a small amount of residual nearsightedness or astigmatism. Presbyopia, or the need for reading glasses, is a normal part of the aging process, and it normally occurs between ages 40 and 50. The reason you lose that near focus is that the lens inside your eye gradually hardens and becomes inflexible. LASIK, of course, changes the cornea, doesn't affect the lens, and that aging process will still occur. If you have LASIK in your 30s, then sometime in your 40s you'll notice the need for reading glasses. If you already need reading glasses or bifocals, then we would offer monovision LASIK. We would correct one eye for distance and one for near. The brain can process those different images, and you end up with excellent vision for distance and near. Monovision is an excellent option for correcting presbyopia. LASIK is considered a permanent correction. Studies have shown that there is little, if any, change once the cornea has healed in 3 to 6 months. A prerequisite to LASIK is that you begin with a stable correction. The LASIK procedure itself is virtually painless. Most people are pleasantly surprised how easy it is to go through. On the day of surgery, it's normal to have a mild degree of scratchy feeling and burning feeling, but this typically resolves overnight. Patients are given a combination of drops to make the eye more comfortable and to speed and assist the healing. Some of the risks associated with LASIK are haze, scarring, over or under correction. The potential complications will be explained in detail in the complementary screening and given in written form. Most potential complications of LASIK are not a permanent problem, but if they are recognized and managed appropriately, patients do well. Every patient who undergoes LASIK is motivated by their own unique situation. In the Northwest here, a lot of people live a very active lifestyle, and being free of glasses or contacts greatly facilitates that. Hiking with glasses is very different from hiking after LASIK. Some people want LASIK simply so that their little ones won't be grabbing their glasses. So it's definitely unique for each patient, but each of our patients have been very happy with their results and their new life once they're free of glasses.